When scientists design experiments to test whether a treatment can reliably produce a desired therapeutic outcome, they do so in a way that's quite artificial from how most treatment is delivered in everyday clinical settings. And so the trade-off that is made is between what scientists refer to as internal validity and external validity. Internal validity is the confident interpretation of cause and effect relationships between a treatment and its outcome, and it depends upon tight or rigorous experimental design and control. And if the experimental conditions hold and an effect is achieved, then you can confidently conclude that the treatment benefited people who got it compared to those who did not. External validity is concerned with whether the findings between the treatment and the outcomes you're trying to produce can generalize beyond the artificial treatment conditions to other clients and other therapists who deliver these in real-world settings. So, in one sense, you could say that internal validity is concerned with answering the simple question, can this treatment work under ideal conditions? Whereas external validity asks the question, does this treatment work in workaday, real-world conditions? Those are different questions. It's possible to do an experiment of a more real-world clinical setting. It's not as tightly controlled, but you can still in some cases hazard cause and effect inferences. And if there were more of those, then we might have greater confidence in the fact that treatments can be rolled out into everyday clinical settings and actually help people. So then the question that is raised is what could be done to the services that are on offer to try to tailor them better to reach people more effectively. Maybe some people in the community would be helped best by trying to develop therapeutic services that really are based first and foremost on indigenous traditional practices that are in some ways crafted from the ground up with local people and that are perhaps assessed or investigated to see to what degree they can help people with particular kinds of problems. And so we don't want to write off any particular approach, but we do need to expand our understanding and conceptualization of the wide variety of therapeutic programming that might be useful for Native people.